welcome back to one of the small video, one of short video. We are going to discuss about certain syndromes which are repeatedly asked in the NEET and INCT examinations. Okay, so during our study, during our preparation for the NEET, we come across many of the syndromes. Okay, so syndrome is nothing but a group of diseases together. Okay, so you can see a syndrome with the different features. Okay, and see, there are certain important syndromes these NEET people are focusing on. Okay, so you may have a n number of syndromes, and you can't, even I can't, or no one can remember all the syndromes. Okay, and what are the features in a syndrome? But the most important ones, which they have already focused on, or the questions being asked, so we can't miss out that. Okay, so many syndromes that we are seeing in during our study about clefting, the syndromes regarding our clefting, syndromes regarding taurodontism, syndromes with facial atrophy, facial hemiatrophy, or your jaw, your tooth. Okay, whatever the developmental anomalies and what are the development syndromes along with it, that we have to learn repeatedly by reading. Okay, now I will discuss here certain syndromes which they have repeatedly asked, and what is the easy way to remember those syndromes. Okay, so first one, I would like to discuss about a small syndrome called Parry-Romberg. This Parry-Romberg syndrome, which we have discussed uh, in the facial hemiatrophy. Okay, facial hemiatrophy. So here in Parry-Romberg syndrome, the most important feature is hemiatrophy. Facial hemiatrophy means one side of the face is atrophied. I have told you. Why I am discussing this big question? Because this is a repeated question. They confuse you with the facial hemihypertrophy. Okay, so in facial hemihypertrophy, it is they usually confuse you with facial hemiatrophy. So Parry-Romberg syndrome is actually called as a atrophy of the face. Okay, that's called facial hemiatrophy. And other points which they have asked in this Parry-Romberg syndrome, because it is localized form of scleroderma. Localized form of scleroderma. Scleroderma is a defect in which all many a systemic defect in which a lot of atrophy of your body happens. Okay, your skin, your cartilage, your bone. Okay, so it is a systemic condition. So it is actually said that the facial hemiatrophy or Parry-Romberg syndrome is a localized form of scleroderma where only the face is affected. So that statement is a true statement. If they say that Parry-Romberg syndrome is a localized form of scleroderma, then it is a true statement. Okay, so here what you see in Parry-Romberg syndrome, we are seeing atrophy of the skin, the bone, the cartilage, or the salivary gland present on one side of the face. And I have told you, I have discussed you the previous question which was asked before in the NEET. Okay, the sharp line of demarcation uh, between the normal and atrophied area, atrophied skin. Okay, and what is that sharp line called? Please try to recollect. We have discussed when we were discussing about facial hemiatrophy. It is Cope-Day-Saber. Okay, see, Cope-Day-Saber. Okay, that's why I'm discussing this question again and again. Now, the next important syndrome which they ask is the Croson syndrome. Croson syndrome. Croson syndrome. Croson syndrome belong to a syndrome family called craniofacial dysostosis. See, the thing we should remember is that craniofacial dysostosis means there is some problem with the cranium, some problem with the face. Okay, so the bone in the cranium and the face is having problem. So Curson syndrome, okay, Apert syndrome are part of Carpenter syndrome. They are all part of the Curson syndrome, the Apert syndrome, the Carpenter syndrome. These three syndromes are part of your craniosynostosis or craniofacial dysostosis. Okay, craniofacial dysostosis means your cranium and the face and something else is affected. Okay, now let's see what is Curson syndrome. Okay, Curson syndrome, what you are seeing is craniosynostosis. What is synostosis? Means fusion. So cranial fusion, the fusion of or early fusion of your skull sutures. Okay, the skull sutures. Okay, you have on your skull you have your coronal suture, your sagittal suture, your lambdoid suture. Okay, you have all your sutures. Okay, your metopic suture. So these sutures fuse what very early. So that condition is seen in your Curzon syndrome. Okay, Curzon syndrome. What are the things you see here? Okay, so it is an autosomal dominant inheritance. Okay, and the question they asked here: what is the gene which causes Curzon syndrome? Okay, the genetic background, the gene which is causing this Curzon syndrome is your fibroblast growth factor receptor 2 gene, FGFR2. That is fibroblast growth factor growth factor receptor. So here the defect is between in the gene which causes the a defect for the fibroblast. The fibroblast is function making the what scaffold for the formation of all these things. So the fibroblast growth factor receptor is the gene which is mutated. So you should remember Curzon syndrome, the FGFR2 gene is mutated. And what all things you see here? You see hypoplastic maxilla, means the mid phase, the maxilla of this patient is hypoplastic. Okay, so that appearance is called frog face. Okay, the person's face will look like a frog. Okay, means midline is not there, you have a prominent mandible. Because of this, mid face is less hypoplastic maxilla, so it will look like a frog face. Okay, and what you see here in the radiograph, there is a peculiar feature you see in the radiograph of skull in this Curzon syndrome patient, that is called copper beaten skull. Okay, the copper beaten skull appearance. So these are one word questions they are keeping on asking in the NEET examination. Copper beaten skull appearance is seen in. Frog face appearance is seen in. Hypoplastic maxilla is seen in. Gene which is caused in the Curzon syndrome. So all these are the question they have repeatedly asked in Curzon syndrome. Now coming to another syndrome, it's called Apert syndrome. So this is very interesting syndrome, Apert syndrome. The Curzon's and Apert syndrome should be studied side by side, because we have features of Curzon syndrome, and along with that we add one more thing, we add syndactyly. What is dactyles? Dactyles means your fingers. Syndactyle, syn means fusion. Okay, so along with the features of Curzon syndrome, the person's fingers are also fused to it like this. Okay, so there is no gap between the fingers. So that condition is called Apert syndrome. You can remember that name is apart, but nothing is apart here, it is fused. Okay, so the fingers are fused, that is called syndactyly. Okay, so that is mainly seen in your apart. So it is looking like the person has worn a socks. Okay, so it is called a sock feet or mitten feet, mitten hand, sock and mitten is you've seen that in newborn kids they put one sock like thing on the hand. Okay, or socks, when we put the socks we can't see the fingers separately. So sock hand or mitten like appearance, mitten hand appearance. Okay, so that is because you are seeing features of Curzon along with syndactyly. So Curzon syndrome with syndactyly is Apert syndrome. Okay, or craniosynostosis, they ask you craniosynostosis with syndactyly is Apert. Craniosynostosis without syndactyly is Curzon's. Got the point? That was the line they have picked up and asked you in it. Okay, so that's about your Apert syndrome. So what are the other things you see in the Apert syndrome is that you are seeing hypoplastic maxilla, just like uh, your Curzon, you are seeing fusions, early fusion of the skull. skull fusions are seen, hypoplastic maxilla is seen, and you're seeing so syndactyly along with it. Okay, now there's another interesting term along with Apert syndrome you should name. You should remember Carpenter syndrome. Carpenter syndrome. Now this is previously asked in NEET 2020 question. The Carpenter syndrome. So we have studied Curson, we have studied Apert. Now what is Carpenter? Okay, Carpenter syndrome is like craniosynostosis. Here we have craniosynostosis. So we have our cursor. Now there is syndactyly. Now we have upper. One more thing extra you are seeing here. For a carpenter to work, okay, you know that a carpenter who works on the wood, carpenter needs more hands to work, right? He is getting more hands to work. So along with this fusion, sometimes he may have an extra digit on his hand. Okay, so he is craniosynostosis, he has syndactyly, and sometimes some extra digit is seen. So that is called as polydactyl, means extra digit, so that extra finger. Okay, that condition is called Carpenter syndrome. Okay, so it is interesting, right? How to study Curson, Upper, and Carpenter. Now we will study a little about your Treacher Collin also. Treacher Collin. Now, Treacher Collin syndrome, so far we were seeing about craniofacial dysostosis, cranium and the face. Now we are going to see mandibulofacial, mandibulofacial dysostosis. Dysostosis means your mandible as well as the facial bones are having some problem. So this is also an autosomal dominant one. Okay, so autosomal dominant one. What are the feature you see here? Feature you see here that the structures which are developed from the first and second branchial arch are defective. So Treacher Collin syndrome is actually a defect of your first and second branchial arch. Okay, so if they tell you Treacher Collin syndrome is a defect of first and second branchial arch, it's a true statement. Okay, now what are the structures which are developing from the first and second branchial arch? So that is defective, right? Your malar bone, or your zygomatic bone. This zygomatic bone is hypoplastic. Hypoplastic. So this bone is not there. Yeah, the malar prominence is not there. Okay, and your mandible is hypoplastic. So when the malar bone is not prominent, what happens? The eye will be drooping downward. Okay, though there is a palpable fissure. The palpable fissure, the eye fissure will be drooping downward. Okay, so downward slant of fissure, palpable fissure. Okay, so all these features, the malar bone is hypoplastic, the mandible is hypoplastic, there is drooping down of this palpable fissure. All this will give an appearance of a bird face. Okay, in Croson it was frog face. Here it is like a bird face, or we say fish face. Okay, see, lot of animals and birds. Okay, frog face, fish face, bird face. So these are fancy terms they can ask you and confuse you. The other thing you can see here is the formation of clefting. Okay, cleft lip or cleft palate. Okay, it can be seen in Treacher Collin syndrome. That's why when we talked about the clefting, cleft lip and palate, the syndrome mainly associated with this clefting, we have seen Treacher Collin syndrome. Okay, now coming to another syndrome, that is a Down syndrome. Down syndrome. See, I'm discussing about the syndromes which they have repeatedly asked questions on. Okay, most all the syndromes are important. Frequently, we see syndromes along with the topic we have studied. Okay, we have seen the cleft lip syndromes, the taurodontism syndromes. Okay, lipid syndromes, the double lip syndrome. Okay, the autosome, your amelogenesis imperfecta syndromes. Okay, whatever areas where you are seeing syndromes, we have discussed in syndromes which where there is enlargement of tongue or facial hemiatrophy. Everywhere we have discussed the syndromes which are associated. Now, other than that, extra than that, I am discussing about the syndromes which they have repeatedly asked questions on. So we have discussed about Parinumber, Curzon, Uppard, Carpenter, and a little about your Techer Collin. Now we are discussing a little about your Down syndrome. Down syndrome, it is called Mongolism. Mongolism, and it is due to your trisomy 21, the triplication of your 21th chromosome. Now, main features you are seeing here in the Down syndrome is that this Down syndrome patient have a large head that is known as brachycephaly, large head and large tongue. Okay, macroglossia. Okay, macroglossia or fissured tongue. Okay, the interocular distance of these patients are very large, or the eye is set apart. That's called hypertelorism. Hypertelorism. The bridge of the nose is kept low. Okay, so that is called depressed nasal bridge. And the maxilla here is hypoplastic. So hypoplastic maxilla, and there is a delayed tooth eruption. But one interesting feature you can see in Down syndrome is that the patients with Down syndrome have a reduced dental caries. Okay. So that's an interesting thing, that the dental caries in Down syndrome patients are very much reduced. So these are certain features you can see in Down syndrome. One last syndrome I would like to discuss is your Men syndrome. Okay, Men syndrome is very easy to remember. The Men syndrome. You know, Men syndrome is men type 1, type 2, and type 3. So what are the components coming in this Men syndrome? Okay, there it is divided into Men 1, Men 2, and Men 3. Okay, Men 2 and Men 3. Now I am giving you an idea how to easily remember what is Men 1, Men 2, and Men 3. Okay, multiple endocrine neoplasias. Okay, that is Men. Multiple endocrine neoplasias means the endocrine glands are neoplastic here. Okay, so many endocrine glands are neoplastic here. So in Men 1 you have PPP, means 3P. In Men 2 you have 2P 1M, means PPM. In Men 3 you have 1P 2M, means PMM. Simple, right? That we will see. What is 3P? We have pituitary gland, pituitary adenoma. So all these are endocrine glands, right? All these are endocrine adenomas, multiple endocrine. Pituitary gland adenomas. Okay. Then parathyroid, pancreas. Okay, parathyroid hyperplasia and pancreatic tumors. So pituitary, parathyroid, and pancreas. PPP, Men 1. In Men 2, you have 2P and 1M. So here the P is what? Not pituitary adenoma, it is pheochromocytoma. Pheochromocytoma. The parathyroid hyperplasia. And last one is your medullary carcinoma of the thyroid. Okay. So these are three glands here: the pheochromocytoma, the parathyroid hyperplasia, and medullary carcinoma thyroid. Now, what about your Men 3? We have 1P and 2M here. Okay. So here, what happens is that there is pheochromocytoma. We have pheochromocytoma, and we have a murphanoid habits, and we have medullary carcinoma thyroid. See how easily we can remember things. Okay, so here you see how the common things are coming here. Okay, so this is how you can remember 3P, 2P, and 1P. Okay, so this is how you should remember syndromes. Okay, so that's about important syndromes and the questions being asked in your NEET examinations. Thank you.